children at the age of 3, and I've actually diagnosed elderly people as I think my oldest patient must have been 85, and she had a diagnosis of irritable bowel syndrome for 85 years of her life until she came to practice with iron deficiency, and the testing was done right away and showed celiac disease. So it was a late diagnosis, but once found, her life was absolutely transformed, absolutely transformed. Next slide. So gluten is the name given to proteins found in wheat, rye, barley, and triticale. Is that how we say it? I think so, triticale. Gluten provides texture to foods, helps maintain their shape by acting as a glue that holds particles together. Wheat is actually found in wheat berries, durum, emmer, spelts, semolina, different kinds of products. Triticale is a more recent development among grains. So remember that gluten is in triticale as well. And it's a more recent development amongst grains. It's a cross between wheat and rye. It is grown to have similar quality as wheat, but it's extremely tolerant to different conditions. So it can survive drought, it can survive rain, it's extremely resistant, and it has high concentrations of gluten in it. We'll move on to the next slide. Now, the main difference between celiac disease and gluten sensitivity is the immune response. If you have celiac disease and eat foods with gluten, your immune system responds by damaging the small intestine. Again, that organ that is really important for digestion, absorption of micronutrients, getting the food across. Gluten sensitivity, on the other hand, shows no measurable immune response or intestinal damage that we can see. Both conditions can cause the following symptoms: brain fog, diarrhea, constipation, anemia, iron deficiency anemia, abdominal pain, weight loss, bloating. The list goes on because we know that celiac disease and this gluten sensitivity, the celiac disease and this allergy to gluten is a strong immune response that can affect any system of the body. From brain symptoms to actually giving us skin manifestation to gut systems. And I think the biggest manifestation we see is from nutrient deficiencies, because you're not able, the lining of that small intestine is altered, is damaged, and you're not able to absorb micronutrients and macronutrients. And that sometimes is the main challenge. Now, there's no definitive test for gluten sensitivity. Sometimes we'll test for certain markers that we'll talk about that can be positive, but there's no specific test for gluten sensitivity as we have for celiac disease. Our next slide is really about testing and diagnosis, and I think this is where we want to really be very, very specific. As a gastroenterologist, it is extremely important for us to know when a patient truly has celiac disease versus when a patient just has gluten sensitivity. We do believe that the whole presentation between gluten sensitivity and celiac disease is a spectrum of gluten sensitivity, of gluten allergy or intolerance. Celiac disease being the more extreme form with strong immune response, and gluten sensitivity being perhaps maybe just at the tip of the iceberg. So now, again, as we said, for gluten sensitivity, there's no definitive test. However, for celiac disease, there is. And before a patient goes gluten-free, we would want to test them, both by serologies, and the ones we look at are the TTG-IgA, the tissue transglutaminase antibody, readily available at common labs like Quest, LabCorp. This is something your primary care doctor can order for you. The test will determine if a patient generates enough antibody to render the celiac disease test accurate. It's positive in 98% of patients with celiac disease who are on a gluten-free diet. If you're not on a gluten-free diet, if you've restricted yourself from eating gluten, we may do this test. It'll pop up negative, but it's a false negative because you do actually have celiac disease. So we do recommend that before our patients go gluten-free, and for at least 6 to 8 weeks, they consume gluten before we do this test to get the most accurate results. This is so important. And it's important that you see a gastroenterologist or a provider who knows how to test for celiac disease, because not every test is the same. I'm going to go in a little bit more detail here because this is important information. There are about 3 main tests that any standard lab will do for celiac disease. That is the TTG-IgA, the anti-endomysial, and you always want to check a total serum immunoglobulin A. Over the last decade, we've actually developed more sensitive tests. That's the deamidated peptides, IgA and IgG. When you see, or when you consult a provider who's well-versed and understands celiac disease, they know that it is important to do the testing for all of these different serologies. We're looking at about 5 or 6 to really get accurate information. And for a lot of patients who I have a very high suspicion, I will test the genetic markers as well, the HLA, DQ2, and DQ8, because sometimes if the serologies of the TTG, et cetera, are negative, but the patient has a positive genetic marker and they're showing signs of gluten sensitivity, I will then assume they probably do have gluten sensitivity and would recommend that they stop eating gluten, they refrain from eating gluten. The reason why we have these more specific deamidated tests is that in a small percentage of patients, if the physician only tests those 3 initial tests, the TTG, IgA, the anti-endomysial, and the serum IgA, we can miss about 3 to 10% of the population who are negative on those tests, but positive on the deamidated. So it's very important to have someone who understands celiac testing and can do a very, very detailed test, okay? I want to talk a little bit more about testing. And sometimes the fact that we'll see false antibody results or questionable antibody results. And this is where the gastroenterologist will generally recommend a diagnostic endoscopy. And when we do a diagnostic endoscopy, we want to get deep into the small intestine. And according to the guidelines, we want to take at least 6 tissue samples from different areas of the small bowel, at least 4 from the second portion and 2 from the bulb. So you want to make sure that and it's okay, you can ask your gastroenterologist, did you take 6 samples from the different areas? Because that is the standard of care to get very good results. Now, if 6 samples are done, and the pathologist has a good read on this, and the results are negative, but the serologies are positive, this can still be celiac disease because studies have shown us that the duodenum is not the only area we can see that abnormal damaged tissue. We can see it in a patchy distribution in the small bowel. So sometimes we'll take biopsies in the duodenum, find nothing, and I may end up doing a pill camera study, which is a capsule that travels the entire 15 to 20 feet of the small bowel, and I'll see patchy evidence of celiac disease much deeper in damaged tissue that we can't access with regular endoscopy. So again, you must be connected with a physician, a gastroenterologist who understands the nuances of celiac disease, because it can be a little bit tricky to make the diagnosis. But once the diagnosis is made, this is life-changing for a patient. Next slide. Who should be screened? Who is at high risk for celiac disease? So we've talked about, it's not about gender, it's not about color, it's not about where you're from. It can affect anyone. But we know that parents, there's a hereditary component. So if your sister, your parent, you're born to your mother has celiac disease or your father has celiac disease, you're at high risk. You should be tested. And we also know that celiac disease is an autoimmune disorder, and autoimmune disorders tend to coexist. So for example, someone with type 1 diabetes, so you have a child, age 14, new diagnosis of diabetes, very important to test them for celiac disease. A large population we see who will have concomitant celiac, so they'll have one autoimmune disorder and also have celiac disease, are patients who have autoimmune thyroid disease like Hashimoto's disease. So it's very important once they have the diagnosis to make sure we do that detailed testing for celiac disease. I see a lot of patients with liver disease who have autoimmune liver disease who also have celiac disease. I just want to put a little nuance in there. We talked about the different signs and symptoms of celiac disease: bloating, constipation, diarrhea. But one thing I've noticed in my practice, and as I've done more research, found this to be true, is I'll sometimes find a population of patients with high liver enzymes, around 50 to 60. And these are not patients who are overweight. This isn't fatty liver. They don't have hepatitis. It is critical that you check for celiac disease because celiac disease can cause high liver enzymes. It causes autoimmunogenicity in the liver, and we'll see the liver numbers go up. So as part of our protocol at my office, at the office of Dr. Asamoah, when we're working someone up for liver, elevated liver enzymes, we always check a celiac panel, and we sometimes find that celiac disease is the answer, the diagnosis here. Once our patient goes gluten-free, we notice the liver numbers come right back down. Other autoimmune diseases to consider, most important ones I'll say is autoimmune diabetes, autoimmune type 1 diabetes, autoimmune thyroid disease. We'll see patients with psoriasis, which is an autoimmune disease, can have coexisting celiac disease. Gut autoimmune disease like Crohn's disease and inflammatory bowel disease can also put our patients at higher risk for celiac disease. I want to talk, moving on to the next slides, which should be long-term health effects. And here I want to talk about the importance of making this diagnosis, distinguishing it from gluten sensitivity. Now, with gluten sensitivity, as we said, patients often will have symptoms, but we don't see that immune destruction. We don't see that strong immune response. But with celiac disease, it is truly an immune-dominated process. Research has shown that people with celiac disease have 2 times greater risk of developing heart disease, coronary artery disease, and 4 times greater risk of developing small bowel cancer. So imagine all of this destruction is going on in the small intestine. There's a lot of immune response, and our patients start developing abnormal cells from inflammation. Again, everything stems from chronic inflammation that's undiagnosed. They start developing abnormal cells and start developing small bowel lymphomas or adenocarcinomas. I'm going to go into a little bit more detail because this is a topic I know well. There's a couple of publications right now on refractory celiac disease. So this is a patient who has known celiac but not doing well. There's type 1 and type 2. The patient with type 1 is probably ingesting gluten in small quantities or may have cross-reaction with other gliadin-containing foods but doesn't know about it. So in type 1, if we check serologies, we'll notice that their titers, the TTG, the tissue transglutaminase IgA, is still high. They need a dietitian who can really help them figure out hidden sources of gluten in their diet, or in their makeup, or in the toothpaste they use. The second type, refractory celiac disease type 2, is a patient who has a diagnosis of celiac disease, is gluten-free, is doing everything they can to avoid gluten, but still has an immune reaction going on in the gut, meaning that gluten is no longer even, restricting gluten is no longer even helping avoid the immune inflammation. It almost seems like things have gone in overdrive. Even with a gluten-free diet, the immune system no longer respects that taking gluten off reduces the inflammation. Things have just gone berserk, things are on overdrive. And it's when we see our patients with refractory celiac type 2, these are the patients who are high risk of developing small bowel cancer, adenocarcinoma, and lymphoma. So usually we'll start with refractory celiac type 2. They'll develop something called ulcerative jejunal-ileitis. That is sort of like the breeding ground for adenocarcinoma. The only point I'm trying to make here is Let's diagnose it early. If you have symptoms, consult a gastroenterologist early, get the detailed testing early, go gluten-free as early as you can, and get regular checkups, just to avoid getting into a phase of refractory celiac type 2 where we don't have much to offer than treating an underlying cancer, okay? If left untreated, celiac disease can lead to anemia. So we'll see a lot of iron deficiency anemia. We see our patients with chronic fatigue. Because of the micronutrient deficiency and not absorbing, we'll see osteoporosis from low vitamin D, low calcium. Infertility issues, extremely common with undiagnosed celiac disease, affecting both men and women with undiagnosed celiac disease. Neurological disorders. I remember in fellowship, one of my first patients with celiac disease did not have diarrhea. She did not have constipation. She just had an unbalanced gait. She would just wobble all the time. And, you know, she had seen neurologists. Nobody knew what was going on. She had iron deficiency anemia. So her two presentations were iron deficiency anemia and something called gait ataxia. So she had this unbalanced gait. She was constantly falling. She was using a walker and she was like 42. And she came into the practice and we did her celiac testing. Every marker was positive. We did an upper endoscopy, classic scalloping of celiac disease in the mucosa. She went gluten-free and it was, I mean, within 3 months, she was walking without a cane. She was doing great. And that just tells you how systemic this disease can be. Affects the brain, affects the gut, affects the skin, multiple organs. So we'll go to the next slide, slide number 10, about associated autoimmune disease. We've talked about this. Celiac disease patients have 15% prevalence of other autoimmune conditions. So very often when we find they have celiac disease, we'll find they have another autoimmune condition as well. So 15% higher risk of developing another autoimmune condition compared to someone who doesn't have celiac disease, where the risk is about 5 to 8%. So this is significant. This is definitely significant. For reasons not completely understood, and I'd love to learn more about this topic, approximately 75% of women make up about 75% of individuals with autoimmune disease. I believe there's a strong hormonal component here. And this is an aspect of functional medicine that we keep looking into and keep developing, but it definitely affects women more often in terms of autoimmune disease, right? Moving on to the next slide. So taking care of yourself when you have celiac disease. One common proactive care is the functional medicine symptom approach. Functional medicine, as you know or may not know, is a system biology-based approach that focuses on identifying and addressing the root cause of disease and is ideal for such conditions as celiac disease. I'm going to expand on this a little bit because I think it's an important point that we're trying to make with this webinar. We've come to a point in medicine where we realize that we have probably subspecialized our disciplines too much and sometimes forget to see the patient as a whole. And celiac disease is the perfect example of this. It affects the nerves, the brain, the gut, the skin. And so you want to see a provider who understands these connections and can help the patient connect the dots so they can heal holistically as a whole. So when you see your gastroenterologist and you're presenting with symptoms that could be a skin rash or neurological symptoms of brain fog and fatigue, it probably and most certainly could be coming from the gut. So the gastroenterologist or the provider, the physician seeing you, the dietitian, the gastroenterologist, the primary care provider seeing you must be able to make the connections rather than just referring you to a neurologist, to a rheumatologist, because some of these diseases, most of these diseases we see can affect the whole being. And so that's really the importance of functional medicine in our practice. Whenever we see a patient come in with the symptoms, be it of shortness of breath, we directly start making the connections and trying to understand, well, could this be associated with something going on in the gut? And if there's a direct connection, we know that we must treat the gut first, and then from there, possibly refer if need be for additional testing. But always making the connections and not segmenting the patient's symptoms is why we practice the way we do at our practice, making functional medicine a priority in how we address root cause of patients' illnesses. And we'd be happy to talk more about that. So we use an approach that addresses the whole body as complete symptoms, as complete systems, rather than just individual symptoms for the patients. And our goal really is to work with our patients in addressing underlying root cause of disease and make sure we treat them holistically and make sure that they really achieve optimal health. And so I want to go ahead and reintroduce Dr. Felmley. Dr. Carrie Felmley's been with us for about a year. She is our Doctor of Clinical Nutrition. She has a degree as a registered dietitian, but went on to do a further doctorate in integrative nutrition. She is very well versed in the topic of celiac disease, how to help patients get on a gluten-free diet, and also how to address micronutrient deficiencies. So Dr. Felmley, off to the nutrition part. That's your part.
Thank you for such a warm welcome, Dr. Asamoah. I appreciate it. I want to go ahead and let's start with the most common question that we really hear, and that's whether or not someone should go gluten-free. Especially if you don't know you have celiac disease, or if you're not really confident on the testing results for gluten sensitivity. And it typically is the number one question I hear from patients when they come in and sit with me. And what I like to tell them is I don't like to overly restrict somebody's diet. There are definitely some cases, celiac being one of them, where gluten is absolutely something that must come out of the diet. But if you don't have any adverse symptoms when you eat gluten, then a gluten-free diet is not always going to be the most beneficial thing, okay? So if someone is not intolerant to gluten, gluten is a harmless protein. Avoiding the protein can be really, really complex. It can be really, really costly. And as Dr. Asamoah did a great job explaining earlier, it can lead to a really increased risk for nutrient deficiencies. When a gluten-free diet is so restrictive, then that can really throw off the balance of your macronutrients, your carbs, fat, and protein. But also it can mean that you are not intaking enough micronutrients or vitamins and minerals. And this can actually lead to malnutrition. So if you're living with someone who has celiac disease, you will want to try and designate some specific space for them to have their gluten-free area of the kitchen, but that doesn't necessarily mean that you need to be on a gluten-free diet either, okay? When we are thinking about actually trying to transition into a gluten-free life, when you've just figured out that you have celiac disease, there is unfortunately only one treatment at this point for celiac disease, and that is not a short-term elimination, but a lifelong elimination of gluten out of the diet. So following a diet that is free of gluten is at this point the only way that we have for people who have been diagnosed with celiac disease to see significant improvement in their symptoms and to prevent the health consequences that Dr. Asamoah was talking about earlier. So some of the most common thought of foods that have gluten that we all know and love is going to be wheat, rye, and barley, okay? What a lot of people fail to recognize, though, this is a little bit debated in the research, and I'm not, I'm not quite sure why so many people forget this, but corn is, if you go and you do your own research on the internet, a lot of websites will actually tell you that corn is a gluten-free option. And it's interesting because when you walk into an agricultural store in Texas somewhere, you will find bags of corn gluten. So I think a lot of people forget about the corn option. So that's sometimes something that's easily forgotten in patients' diets, I find. But when we're looking at common wheat sources, where we get a lot of wheat in our diet, this is going to be found in a lot of breads and baked goods. So the really delicious things that we so love in the holidays that are coming up, all the different pastries, cereals in the morning, that is a really good quick option for a lot of people before they start to make that diet transition into more of a whole foods diet. I do find a lot of people are pretty reliant on cereals, but beyond this, you're going to find gluten and wheat in even soups. A lot of times it's used as a thickener. People typically know pasta is one of those, but even gravies and things like that are going to contain wheat as well. When we're looking at barley, this is going to be a little bit more not so common as the wheat is, but you can find the biggest one that you're going to find is malt balls, malted milkshakes, those type things are going to have a lot of barley components in them. Barley is also used in a whole lot of food coloring. So this is one of the areas where you're going to find a whole lot of hidden sources of gluten. When we think through things like soy sauce, which, you know, for the average person, you would never think that gluten would be in soy sauce, but it is simply for the coloring. And so celiac patients need to be very conscious of choosing gluten-free options in that regard. Brewer's yeast is another one that most people don't think of as containing gluten and barley, but that also means that any kind of beer or malted fermented alcoholic beverage is going to be included in that as well. Rye is going to be a little bit easier than barley. I think it's pretty common up there with wheat, and people think of rye breads and that kind of thing pretty commonly. And so that one's an easy one to kind of suss out in the diet. So gluten, since it is a protein, it has kind of meandered its way into a lot of different food sources that can make it really difficult to avoid. We already talked about soy sauce, but when we are talking about breads and pastas and things like that that are containing gluten, they're in there for a lot of stabilization. We talked a little bit about the food coloring and that kind of thing, but this is one of the reasons why gluten-free, I should say, breads taste so different to gluten-containing breads. And they can be a challenge for sure to find a gluten-free option that tastes good to patients, simply because that stabilizer of the gluten that is holding up the air pockets in the bread, which makes that delicious, light and fluffy bread that we all know and love, is we don't have that protein. We don't have that strength anymore. And so you'll find that going to gluten-free options are going to be really crumbly and have a much different texture than you're used to. When we are looking at gluten-free products, because there is no known cure for celiac disease, the only real way to manage the condition is to be extremely, extremely strict at adhering to that gluten-free diet. So even though that is lifelong, there are really good food swaps that patients can do that are really essential to not only eat gluten-free, but to make eating gluten-free really healthy in their alternative choices. There are many, many, many gluten-free food options available on the market now. We've come a long, long way in the last 10 years, but many are highly processed, and consuming a diet of processed foods will not help you repair your immune system, which is going to be a really important part of celiac care. in the long term. We really want to strengthen your immune system as much as we possibly can. And so you can be gluten-free eating whole foods and really healthy foods that are full of vitamins and minerals, but you can also be gluten-free eating a sandwich. You know, you can find gluten-free PB&J for the rest of your life. And I don't think anybody would argue the fact that both of those are two vastly different as far as their health benefits. The next topic I kind of want to talk about is, because micronutrient deficiencies is such a risk factor when you are trying to implement a gluten-free diet, I want to take a minute just to really look at what the best nutrient-dense food options are. Okay, some of these are really common sense. Okay, as far as vegetables and fruits, obviously those are going to be a good choice, but also nuts and seeds, beans and legumes are going to be really vital as far as building up that microbiome and helping to support the immune system repair as well. But also some lean proteins. So in celiac disease, when you're causing damage and trauma to that intestine and you're trying to repair it, proteins are going to be vital in that repair process. And so really good, healthy, micronutrient dense proteins are going to be a great part of that diet. Vegetables are considered to be our foundation of any healthy diet. That's part of the common sense aspect of it, right? So different kind of nuts and seeds, especially flax seeds, pumpkin seeds, and hemp seeds, are particularly good sources of omega-3s, which have an anti-inflammatory effect. And typically in the standard American diet, we're going to have much more omega-6s than omega-3. So anything that we can do to add in some omega-3s into our diet is really going to help that anti-inflammatory repairing process. Some other foods that we're going to make sure that we really prioritize getting good quality of in that protein that I mentioned earlier this is where we can combine the omega-3s with some of the good quality raising methods that we can go into a little bit. But when we're looking at wild caught fish, so everybody thinks of wild caught salmon, and which is a great option, but you've also got mackerel, you've got sardines and herring and different kind of fishes that are going to be cram-packed of healthy omega-3s that are really going to help that anti-inflammatory process. So one of the hardest areas I personally think in order to go gluten-free, the vegetables and the fruit, those are kind of easy. The proteins, for the most part, you can find some hidden sources there too. But I think that by far and large, the hardest part to change in somebody's diet is going to be the grains and the flours, okay? So when we're looking for a gluten-free flour option, flours should be, and you should be looking for on your container, something that is going to be certified to be completely gluten-free in order to be considered safe. Some flours that can be eaten, some examples are going to be like cassava flour, chickpea flour, quinoa flour. We've also got some good gluten-free nut options, such as almond flour. That would be a good one. Rice flour and coconut flour are some that I can think of off the top of my head. But look for that naturally gluten-free whole grain when you're looking for grain options. Some of the most common ones that you're going to be able to find at any store across the nation is going to be quinoa is going to be a great one. Rice, but also millet, okay? Some patients like buckwheat and amaranth as well, but I do find patients typically like the millet and the quinoa better. Obviously have some fun, be some adventurous with what you're trying and try different food options. But as far as the most diverse and easy to implement, that's the kind of feedback that I am at least getting from patients. When we are looking at the healing process of celiac, once you're diagnosed though, is one approach that is really important to include that I mentioned a little bit earlier is really concentrating on the immune system. So to heal the gut, you're going to need plenty of beneficial, good bacteria in your gut. And we can get those, when we ingest those orally, we call those probiotics, okay? Probiotics are basically live versions of the good bacteria, and we're just supplementing them, what we naturally find in our microbiome. So those probiotics are going to be really, really important to help fight harmful bacteria that are living in the body, to restore and maintain a healthy balance in the gut microbiome that allows it to heal as well and completely as we possibly can. Some examples of some food options that we can, instead of taking a probiotic supplement, we can also get probiotics in our food choices. And some really good food options are organic yogurt or kefir. Kefir is very similar to yogurt. It's just a little bit thinner, so it's drinkable. Okay, but you've also got sauerkraut and kimchi, which are fermented foods that naturally help and build those probiotic strains and quantities in the food itself. When we are looking at, okay, so if you've just been diagnosed, somebody in your household has just been diagnosed, it actually is going to be really important to spend a little bit of time making your kitchen completely gluten-free. Okay, and that's not normally something that we think of as far as gluten residues. Okay, but it's going to be really important to eliminate all the gluten residues that are going to be left on the surfaces, the various surfaces of your kitchen. And this is basically going to prevent some cross-contamination. Okay, so some really good first steps to creating a gluten-free kitchen, if you will. The first one is pretty obvious. Throw out all the gluten-containing food and baking mixes and that kind of thing. Next, I would probably remove the toaster. You normally don't think of this is something that gets overlooked a lot, but one of the #1 gluten-containing foods is obviously breads. And if we're making toast all the time, that toasting process is going to leave a gluten residue inside the toaster oven that is going to be darn near impossible to clean. I promise you, it's not worth the effort. I have tried myself. It is well worth just getting a new toaster. But also I would be purchasing new jars of condiments, especially, just because condiments are a really easy source of, you have some, just like soy sauce we talked about earlier, that is gluten containing, and then you've got some gluten-free options. And it's how many times I have heard from patients, I grabbed the wrong bottle and I regretted it. So purchasing some new jars of condiments to where all the condiments in the fridge are gluten-free is a pretty good preventative step. You're going to also want to replace some of your plastic utensils and your nonstick pans. Again, that goes back to the residues on the gluten. So I'm sorry, we're having just a little bit of technical difficulties. Okay, all right. So we actually, the message, it's not a technical difficulty. We are realizing we are actually running pretty short on time. So we are going to skip ahead to some of the end. Let's see. Okay, let's skip ahead. All right. Okay. So some of the other areas, I'm going to skip over some of the slides that you may be able to more easily find in your research, such as the gluten residues, but I don't want to skip over before we end and go to questions. I want to really get a really good understanding of when we talk about gluten-free. So even though we use the term gluten-free, the FDA has termed what that means. It's a really big misconception that when a food says gluten-free on it, it means that it contains absolutely zero gluten in that product, which is actually inaccurate, okay? So when you're looking at a gluten-free product, to be considered gluten-free according to the FDA, it needs to contain less than 20 parts per million. Okay, so sometimes patients can have a hard time visualizing exactly what that means or understanding what that means. So if you were going to think of a bag of blue marbles and you had 1 million blue marbles in this bag, then out of that million, 20 or less of those would be a different color. Okay, let's say white is gluten. So for that product, 20 or less of those 1 million marbles would be the white gluten containing marbles. Okay, that's the easiest visual I can think of to really visualize that. But at this time, we just don't have the technology that can detect and reliably test for 0% gluten. So 20 parts per million is the amount that has been deemed safe, okay, for those that are celiac, okay, to consume and not cause damage. Okay. I am gonna jump through this really quickly, but I couldn't resist sharing some good recipes with you, especially comfort foods. So on our resources page we'll be sending you are gonna be some comfort foods I think taste delicious that are gluten-free. So one of them is gonna be a pizza, one of them is gonna be French toast and muffin bites and things like that. So we'll get that information to you guys. And as I said just then as well, we will be sending a resource page that will be including all the resources that I would have talked to you about anyway. So you won't be missing any of that information. So since we are running short on time, what kind of questions do we really have? Michelle, have you been monitoring the chat, or how many do we even have time for?
I have a question. I have a question from a patient or from a viewer that says, do I Carrie or myself, do we eat a gluten-free diet? I do not eat a gluten-free diet. I do not believe I have celiac sensitivity. I know I don't have celiac disease. But I do minimize gluten in my diet simply because I do know that it can be pro-inflammatory. And I actually do prefer eating more fruits and vegetables. And recently found I love bread, but I recently found a great gluten-free bread. Carrie, do you remember the name of the
sourdough? I don't, but it's that really yummy sourdough buell, isn't it?
Yummy sourdough that is super soft. My almond butter just melts right on top of it, and my kids love it. So I'm really trying to find other sources of non-gluten-free foods to enjoy.
As for me, I do really enjoy a whole foods diet. I also have a preference for vegetables and fruits. That's just been a little bit of a bias of mine, but I am not celiac. I am not gluten sensitive, or at least I do suspect I actually am mildly gluten sensitive. Not anything where I need to restrict gluten. I do prefer being gluten-free. My main symptom that I get when I eat gluten is I get really, really tired within about 30 to 60 minutes, where you definitely know it's going to be a 2-cup of coffee kind of a day. So just for my own energy levels, I do try to minimize my gluten as much as humanly possible.
There's another question about perhaps a difficulty in diagnosing a patient with celiac disease if they have gluten-6 phosphate dehydrogenase deficiency, G6PD. I haven't heard about that particular deficiency affecting the serology testing. Dr. Felmy, do you know anything about this? I have not heard this in the literature or read this in the literature.
You know, if I'm being honest, we were dealing with a technology problem right here. Can you actually repeat the question?
So the question was whether someone who has G6PD deficiency, in someone who has G6PD deficiency, would it be challenging to diagnose celiac disease?
You know, as far as the latest literature on that, you know, if I'm being honest about it, I haven't seen much on that.
I haven't
I would
seen
need to dig into the literature to see what was most recently researched on that to give a confident answer.
There's an important question about a topic you raised. Corn is a no, even if something says gluten-free. That's the question so corn is a no, even if something says gluten-free.
I'm nodding because I'm understanding the question. Don't be too scared. The answer is actually no, you can find gluten-free corn. So there are different processing methods that can reduce and remove the gluten. It will destroy the protein that is in the gluten. So you can find gluten-free or 20 parts per million products that do contain corn that are gluten-free. So you can still do your corn tortillas and that kind of thing. You just need to be very specific about looking for that certified gluten-free mark on the package.
Thank you, Dr. Felmy. A question that I sometimes have from patients is, once diagnosed with celiac disease, how often should I get my serologies checked? How often should I see a provider? I believe that once you start your journey on a gluten-free diet, it is important that we at least make sure that serologies are negative after at least, I would say, 8 to 12 weeks, just to make sure they're actually trending down. So if we started off with very high tissue transglutaminase levels at over 100, once you're gluten-free and you're on that and it's working out for you, we want to check and make sure that levels have dropped down significantly. And if our patient is gluten-free, we'll see it go down to even undetectable or a 10, a very low number. So that follow-up at three months is important. And also making sure that micronutrient deficiencies were identified and are being replaced. So that's really important. And also making sure that as they are being replaced, we're actually checking at 3, 6, and perhaps a year to make sure that your levels have come up to where they need to be. In terms of getting a repeat endoscopy, this is not necessary. I do not believe that repeat endoscopy is necessary to assess gut mucosal healing, especially if we are able to follow the trends on the serology testing and actually see that your gut is absorbing and your nutrients are coming up. We don't need to keep repeating endoscopy. That's not standard of care. Dr. Felmy, anything to add there?
Actually, no. I think you wrapped that up very comprehensively. Yeah.
Okay.
No. I do see a question in here about how often you should be checking your vitamins and minerals. And my preference for that would be annually. So here at the clinic, we do test through serum blood for a certain number of vitamins, but that's not a complete vitamin panel. So what we love to use here in the clinic is actually something called organic acids, which are a byproduct of metabolic processes in the body. And this gives us a really comprehensive and really good information on what your body needs at the time. The number of vitamins, the amount of vitamins and minerals that you need depends on a lot of things: how much stress you're going on, how much healing you have to do, whether or not you are more athletic, or whether you're losing weight that year, or what the case may be. Those needs change on a continual basis. So personally, I recommend to patients to get their organic acids tested at least once a year. And that way you can really adjust how much additional micronutrients you need on top of your diet. The goal, obviously, to be getting as much as you possibly can from diet, but additional needs can be met through that annual testing.
Okay. We have a question, and this may be our final question on before we get into our question. We have a question for the audience. I'll ask the question about research. So the question is, are there any links and or research available regarding wheat allergy and celiac disease? This is an important question, Dr. Felmy. I think this kind of goes into our whole conversation about food reactions and what is a true food allergy that is IgE mediated, meaning immediate allergy. We'll see someone eat peanut or strawberries and develop an immediate rash, go into anaphylactic shock, versus what is a food sensitivity or a delayed immune reaction, which is IgG mediated, which is very often very difficult to diagnose. We've talked about the benefits of food sensitivity testing and their pros and cons to all of it. And we've done a lot of research together as a group here, looking at all the recent publications and the different types of kits available and what is really helpful to our patients. There is a good link through the Celiac Disease Foundation on wheat allergy and and celiac disease, and we'd be happy to share. I think Dr. Felmy maybe had included that in the share notes, so we'd be happy to share our notes at the end of this talk, which includes some great apps for our patients who suffer from celiac disease or gluten sensitivity, resources for just information and further testing. We've compiled everything, and recipes, right? We've compiled.
I couldn't help myself.
There you go, one page. So we'll definitely share that with the audience today. There's another question about organic acids, and we'd be happy, that's a detailed answer for that. Dr. Felmy and I would be happy to discuss that. If you want to schedule a discovery call, we do have discovery calls for our functional medicine practice. It's a 15-minute conversation about how functional medicine could be helpful to you. It's a free consultation, so we could definitely sign you up for our discovery call, absolutely. I'm saying last question, but one more. I'm going to answer somebody else's question about, can celiac testing be included as part of the yearly blood work? Absolutely. It is not part of the wellness package that your insurance will allow for. Generally, as you know, when you see your primary care doctor for that wellness visit, they're checking your blood counts, a basic lipid panel, your liver function, your thyroid function, and vitamin D if you're lucky. They do not generally test for celiac because we want to screen our highest risk patients, right? Autoimmune disease symptoms, so it's generally not included. But if you see a gastroenterologist or you're having symptoms and your primary care doctor thinks about the diagnosis, or you suggest the diagnosis, please suggest the diagnosis to your doctor when you believe it could be it could be what's bothering you, because the patient knows best. Like, you know your body best. So your doctor should be open to just saying, okay, let's go ahead and test and see if that's the case. But no, it is not part of the yearly blood work. So you can't assume it has been checked, okay? So we're gonna sort of wrap up. We have one question for our audience, just to see if they didn't fall asleep during this presentation. Dr. Felmy, do you want to read off the question?
Sure.
And what we're actually doing is the first 5, did we say? 5 audience members who reply correctly to the question get a free nutrition consultation with Dr. Felmy. So do you want to read off the questions? And I will say the answer at the end. This one is a trick question. It is a trick. Do you want to read it off, Dr. Felmy?
Sure, absolutely. So which of the following is not a long-term health effect from untreated celiac disease? Is it GERD or acid reflux? Is it small bowel cancer? fertility, anemia, or is it all the above?
None of the above.
None of the above.
Yeah,
That's what
which
I
is
get for taking my eyes off the screen for 2
long
seconds.
term. This is a negative question. It's a double negative. I'm going to put it in simple terms, Barney style, what I can understand. Which of these symptoms are not part of, are not long-term health effects from untreated celiac disease? Meaning, if your celiac isn't diagnosed, which of these symptoms would you actually present with? You know, which really, so the last part really should be change it. Yes, it should be all of the above. Our patients who have celiac disease, who have not been diagnosed, who are still eating gluten, can suffer from GERD. It's usually one of the most common diagnoses. We didn't list it, but it is one of the most common diagnoses. Small bowel cancer, infertility, and anemia. So it's actually all of the above. And we do have several winners, okay? Several winners. I don't want to mention anyone's name, but it looks like we have 3. And our list is 5. We said we'd offer 5 nutrition consultations for free with Dr. Felmley. Really, I think what she'd love to do is focus on making sure there is a clear diagnosis if there's a suspicion of celiac disease or gluten sensitivity, or just helping you with your first nutrition sort of consultation journey and your objectives. But we are going to definitely message back the 3 that definitely got it correct, and we're going to just throw in 2 additional patients, 2 additional audience members, and I'm just going to let Dr. Felmley pick names. And so they're going to at least be 5 of our audience today that get that free nutrition consult, and we'll try and schedule that between now and the end of the year. We thank you guys very much for joining us on this webinar. It's our first webinar. We hope to have more of these going, hopefully every quarter. We want to provide not just superficial information, but detailed information to the audience, because we know that a lot of you are on that Dr. Google. You already know a lot of stuff. Yeah. So we gotta come prepared. We gotta bring our game face on and come prepared with detailed information. We thank you so much for joining us. And message us for topics that you're interested in. You know, we'd love to learn what you want to learn more about. Have a wonderful evening, Dr. Felmley.
I was just going to say, since we're about to hop off, so that we can actually get your message, we would really love to know what topics you would like to discuss more in detail. You can always email us at wellness@drasamoah.com. We would love to hear from each and every one of you what you would like to hear about most.
All right. Have a wonderful evening. Thank you, Dr. Felmley.
Have a good